Okay, hello everyone, and we're going to complete our discussion about bacteria and the cardiovascular system. And I'll just return to the last slides that we covered in class to remind you. One of the most important and critical medical conditions is sepsis, which is a reaction of the immune system causing a catastrophic shock, massive loss of blood pressure. One of the most important sources of the sepsis is gram-negative bacteria. And the gram-negative bacteria, because they possess in their outer membrane, remember the gram-negatives have an outer membrane, which the gram-positives do not. And in that outer membrane, there are elements which are composed of lipopolysaccharide, not the normal phospholipid that we see in the cell membrane, but lipopolysaccharides, which are highly, highly antigenic. And these form an endotoxin. That is, they are part of the structure of the bacterium, and they are released when bacteria die. When bacteria go into circulation, causing septicemia, naturally, as they proliferate, some of them are going to die, and they're going to break up and release these particles into circulation. And the immune system reacts extremely strongly to these. And because it is global, it's being circulated all over the body. The effects are global. And it causes a catastrophic loss of blood pressure, along with other elements as well. There may be shutting down, there may be clotting in peripheral blood vessels, all sorts of other knock-on effects. But this is a very, very dangerous situation. And it can arise quite easily because many of the gut bacteria are gram-negative. And if any of them have get an opportunity to start circulating in the blood circulatory system, they can cause this gram-negative or endotoxic shock. Endotoxic because it is caused by an endotoxin, a part of the bacterium itself, not by a released exotoxin. So some of the common gut bacteria, such as E. coli, Klebsiella, these can actually cause this endotoxic shock. And thinking back, remember enterohemorrhagic E. coli that we talked about before. Remember that enterohemorrhagic E. coli, not only was it able to cause endotoxic shock when it went into circulation, it also produced other toxic effects as well. Remember this because in your exam, you're going to have a written question on pathogenic strains of E. coli. All right. There are other bacteria which can also cause it. This one, Pseudomonas aeruginosa, is an opportunistic pathogen. It's actually an environmental bacterium, but if it causes a septicemia, it can very quickly result in endotoxic shock. This creates a great difficulty in treating these septicemias, because if you simply blast the patient with antibiotics, you kill many of the bacteria, they release the particles into circulation, and you have a dire situation. Instead, these lipopolysaccharide components need to be neutralized in some way, either with antibodies or some other means. And then also they are treated with, the patient would be treated with immune modulating therapy to stop the immune system producing this kind of cytokine storm, which results in the shock itself. So that is endotoxic or gram-negative sepsis. And the gram-positives can also cause a sepsis, but they obviously don't do it through an endotoxin because they don't have this outer membrane. There are elements of the gram-positive cell wall and in the cytoplasm as well that can cause a shock, but much more commonly Gram positives cause shock by release of a toxin, that is, by exotoxin. And I'll just remind you that we've talked in both case of Streptococcus and of Staphylococcus, that both of them are able to produce these exotoxins with very powerful effects, disease-causing effects. Now, in the case of Staphylococcus, we talked about its Staphylococcus aureus causing a food poisoning, and it did so by releasing a toxin, which when we ingest it, causes us to have a gastrointestinal illness. It's usually self-limiting. It's not particularly dangerous, but very unpleasant. But these same exotoxins, if they were to go into circulation, can cause a shock situation. And this is called a toxic shock because the body is reacting to an actual toxin, an exotoxin released by the bacteria, not to the bacteria themselves. So the most famous instance of this is in the case of a production of a new kind of tampon in the 1970s or 1980s, early 80s, I can't remember exactly when it was. Manufacturers of tampons designed a new tampon for women to use, which could be left in the vagina for a long time. And this was supposed to be convenient so that women didn't have to change tampons frequently when they were menstruating. The problem was that these new manufactured tampons were contaminated, and they were contaminated with Staphylococcus aureus, ordinary Staphylococcus aureus. But left in the vagina at 37 degrees, and of course soaked with body fluids, which are a rich source of nutrient to the bacteria, bacteria would proliferate in the tampon, and they would release toxin. And the toxin would be absorbed across the vaginal wall, go into circulation, and it caused a toxic shock, and was referred to as toxic shock syndrome. And it resulted in numerous mortalities. It was a tragic situation because these new tampons had been widely distributed, and it took a long time to put together what was happening and actually withdraw the manufactured, the ones that were still on the shelves. This is, of course, led to increased vigilance for quality control, et cetera, and the manufacturing was changed so that it no longer happens. These gram-positive sepsis can also be caused by other enteric bacteria, such as Enterococcus. There's two species, particularly Enterococcus faecium and Enterococcus faecalis, slightly different species. But this arises as a nosocomial or health-acquired infection. And when wounds or urinary tract are infected with these Enterococcus species, they are able to proliferate and gain access to release toxins to the bloodstream. Unfortunately, these are highly resistant to antibiotics. So this is a very difficult situation to cause. But this is not a very common HAI, nosocomial infection, but nonetheless, it does arise. There is one type of disease associated with gram-positives, which results in sepsis, which is really used to be extremely common. And this is puerperal sepsis, or sepsis associated with childbirth, often referred to as childbirth fever. During childbirth per vagina, a lot of damage can arise to the reproductive tract. First of all, the uterus has a huge area which needs to heal, where the placenta detaches from the uterus wall, which can be colonized by bacteria. The cervix may be stretched and torn, the mucosa stretched and torn, even the vagina. And as a result, there are multiple surfaces where bacteria can gain access and move from the reproductive tract into the abdominal tract especially, and causes septicemia as well. This was very common, very, very common in healthcare settings, right up until the middle of the 19th century. And in fact, women suffered a far higher mortality if they went into a hospital setting to give birth than if they gave birth at home. Doctors were in fact far more dangerous than midwives, because midwives tended to observe, not through any deep knowledge of germ theory or anything, but midwives in fact tend to observe better hygiene. And you remember we learned at the beginning of this class about Dr. Semmelweis. Semmelweis demonstrated in a hospital setting that doctors themselves were transporting infectious agents from patient to patient. And he instituted simple hygiene of washing with chlorine-infused water, similar to our bleach, between patients. And he was able to lower the incidence of puerperal fever, childbirth fever, in his hospital setting. Once it was realized that common hygiene was able to limit puerperal sepsis, the incidence dropped. But it still does occur, and it occurs especially in developing countries. And ultimately it results in a gram-positive septic shock. So it's a combination both of septicemia and of a toxic shock because of release of exotoxins. Okay, so you can also have bacterial infections of the heart. Now, this situation arises because, of course, all blood is passing through the heart continuously. If you have bacteremia, you have circulating bacteria in the blood system, or septicemia, where bacteria are actually proliferating in the cardiovascular system. It is very easy to infect the surfaces of the interior of the heart. And one of the places where this is particularly important is around the valves. And the reason for that is the valves operate mechanically, and then mechanically, the heart is mechanically pumping liquid, which causes eddies and swirls, you think of them like whirlpools around the valves as they open and shut. There are areas of low velocity where bacteria can actually settle on the surfaces of the heart. The heart is cloaked on the interior with tissue called the endocardium, very, very specialized epithelial tissue, which is designed to allow the blood to flow past without stopping, to prevent clotting against the endocardium. And when that endocardium becomes infected and inflamed, that is referred to as endocarditis. And it is particularly dangerous, not only because of the inflammation, but because it encourages blood to clot around the inflamed surfaces. Now, subacute bacterial endocarditis is usually caused, it's a condition where the heart valves themselves are affected. And it's usually from streptococci. And this is the cause of what used to be referred to as rheumatic fever. Often, this kind of endocardial tissue occurs widely throughout the body. And one of the places where the streptococci from an oral or tonsil infection, whatever, can settle is in the joints. And often that was an initial symptom. But the danger was that these streptococci causing this rheumatic condition in the hands, feet, would also settle around the heart valves and actually colonize the heart valves. Now, there's two things that can happen with these streptococci. The first is that they release an exotoxin. And the second thing is that there are components of the bacterium called the M proteins to which the immune system reacts on the bacteria. And unfortunately, we have very similar proteins as a normal part of our endocardium and of other parts of the body. And there can be an autoimmune response, which damages those tissues in the heart valves, in the joints, and various other places. But there's also a toxic component to these bacteria, which causes other knock-on effects. So acute bacterial endocarditis is where we have actual damage. Subacute is where we have colonization. Acute bacterial endocarditis is where we have actual damage to the heart valves, and that may be permanent. And so rheumatic fever in the old days, prior to antibiotics and vaccines, the rheumatic fever was a common cause of heart damage in children. In addition, these bacteria, usually gram-positives, can infect the pericardium. That's the sac around the heart. So these can cause very severe damage to the heart itself, and especially to the heart valves. So this is endocarditis. This is what normal valve tissue looks like, the smooth, shiny, pink color. These are surfaces which are colonized by bacteria. And you can see that they're extensively damaged. This is, in fact, probably a post-mortem dissection of a heart valve. This is a very serious situation, but nowadays, in developed countries, it is relatively uncommon for this to arise because bacterial infections of the throat are very quickly treated with antibiotics. So here is just a summary of what I've just told you about the dual nature of the streptococcal infection. There can be a toxic component, but then there's also this autoimmune component, which can cause problems. Okay, so now we come to one of the most famous diseases of all. And this is plague, Black Plague, which was epidemic throughout Europe and Asia, right through the Middle Ages, through the medieval period. It caused repeated pandemics of illness, and it has had, in those days, a spectacularly high mortality rate. And in the Great Plagues, in the 13th century, in many areas of Europe, more than half of the population were killed by plague. And plague resulted in the complete restructuring, the collapse of the feudal system through much of Europe. And it resulted, in fact, in the construction of what we would now refer to more as middle class. Prior to plague, the populations were largely divided into the nobility, the peasants, and then into a merchant class, who were actually relatively small and belonged to guilds, which restricted their membership. And most people were peasants and were essentially in a form of indentured servitude. The plague struck indiscriminately at the nobility and at the peasantry, and it reduced the populations so significantly that labor became extremely rare. And people who could offer labor, the peasants who could offer labor, could actually begin to bargain for their wages. They could say, no, you're not going to pay me enough. I'm going to go to somebody else. Where before there were so many people that they were obliged to take whatever they could get. Post-plague, especially the Great Plague, people acquired the ability to bargain for their wages and their positions. And this was the beginnings of our middle class. They began to move out of the indentured slave servitude of the peasantry and to a freer, more independent earning of their wages. So these diseases can have huge, huge impacts on human history, especially when they have such an incredibly high mortality. Now, this disease, the plague, is caused by an organism called Yersinia pestis. It's, again, a gram-negative rod. And its etiology is somewhat complex. The story is for plague, the story that has always been told is that a plague was imported to Europe along with a new kind of rat, which was an Asian rat, which arrived with trade routes carrying a flea, which was able to transmit this bacterium. In actual fact, the bacterium is quite widespread, and it is endemic in many areas. And we don't actually understand what it was that set off the plagues. Modern thought is that, in fact, the story of it being because of the importation of new rats may not, in fact, be true. There may be other things that affect. It is certainly transmitted by rat fleas and by a particular rat flea called Xenophila chiopus. And what happens is the bacterium infects the flea, and it causes a blockage in the flea's gut. And the stomach will fill with blood, but it won't go any further. The flea still begins to feel hungry because it's not getting any nutrition. So what it does is it climbs on a host and it vomits up the blood that was stored in the stomach, and it bites again. And the blood, this mixture of blood with bacteria, because the bacteria breed prolifically inside the stomach. When the flea bites, it injects bacteria into the wound. The person may worsen it by scratching and injecting more bacteria into the bloodstream. What they do, first of all, is they begin to form sores where the bacteria enter, but they then migrate, and they migrate up to the lymph nodes, and they cause these very, very painful abscesses on the lymph nodes, and these are called buboes. This explains the other name for the plague, for epidemic plague, and that is bubonic plague. Bubonic refers to these painful swellings called the buboes. And apart from that, there is also a septicemia, as the bacteria, remember, they're gram-negative, so they have an endotoxic element to them. And this can cause death through a septic shock, just as we've seen with the other circulating gram-negatives. However, the bacteria can also spread to the lungs, and they cause massive damage in the lungs, and people begin to cough up blood, and they cough up blood in paroxysmal coughing, violent coughing that causes fine mists of blood and bacteria to be expelled. And this is the second way that the bacterium can be acquired, is through droplets. So all of that together, fleas spreading the disease, and then the pneumonic plague element, meant that this disease in the cities, in crowded settings, on ships, all over the place, this disease spread like wildfire. And the pneumonic plague, there's about 100% mortality rate. People simply don't recover from pneumonic plague of the lungs. Bubonic plague, there's a 50 to 75% mortality rate. And this is huge, absolutely huge. There are few other diseases infectious diseases in human beings with a mortality that even rivals that. Now, in modern times, bubonic plague, pneumonic plague are almost unheard of. It occurs sporadically because it is in fact endemic. Here in the United States, it is endemic in things like prairie dogs, those sort of things. And every now and again, you'll get somebody popping up with plague, but it's very easy to diagnose. It is so distinctive, and there are numerous tests that can be done, and it's very easily treated with antibiotics. And if people in a family, say if somebody gets plague, other members can be treated prophylactically with antibiotics. So it is in developed countries, it is no longer a problem, but it does still occur as minor epidemics in developing countries. One of the things about the bubonic plague also was this is a typical result of endotoxic shock. And remember, I told you that one of the things that happens in endotoxic shock is the fine blood vessels in the periphery begin to clot and to shut down. And it produces this blackening of the extremities. And this is another name for this disease, was the Black Plague. And this was one of the reasons why. And the old nursery rhyme, ring-a-ring-a rosies, pocket full of posies, a husha, we all fall down. That is a remnant of these terrible black plagues, which took place in the Middle Ages. And ring-a-ring-a rosies referred to the initial bites, because what would happen is that around the bite, you would have a reaction and a lymphadenopathy as the skin reddened around the bite, and the lymph vessels began to inflame. Ring-a-ring-a rosies. Pocket full of posies referred to the fact that people believed that if you carried sweet-smelling flowers and things, it gave you some protection from the disease. It did not, of course. But it certainly might dampen the overwhelming stench from corpses and everything else. Pocket full of posies. Husha, a husha. Husha, a husha. One of the first signs of pneumonic plague was sneezing. And as soon as people began violently sneezing, they would know that they were on their way to pneumonic plague. We all fall down. It's self-obvious, okay? Ring-a-ring rosies. You've got a pocket full of posies. A husha, and everybody dies. Not anymore. We are very lucky. So here, just to point out, here in the United States, it is also endemic in the Southwest, particularly. And this is over 16 years span. These are the figures. It just arises occasionally. And this, I don't think there would have been any mortality from this at all. It is really very easily diagnosed and very easily treated. But you can see how it's clustered in the Southwest and particularly associated with endemic rodents in that area. Okay, let's have another disease that you have surely heard about. And this is Lyme disease or borreliosis. Borreliosis because it is caused by a spirochete called Borrelia burgdorferi. And here it is here. You can see here's a tightly coiled, long, very thin spirochete. And it's a tick-borne disease. Ticks are an arachnid, which are very common vectors for different diseases. And one of the reasons for that is that they can move between mammalian populations very easily. And many of the tick-borne diseases are, in fact, zoonotic. They're diseases which normally are held in animal reservoirs, but occasionally pass into the human population. Borreliosis is, in fact, the commonest of all of the tick-borne diseases in the United States. And data has various reservoirs, but field mice are actually the commonest reservoir. And it's not the adult tick that transmits the disease to human beings. It's actually a nymphal, that is a juvenile, not yet mature tick. There is a very complex life cycle to this organism. First of all, here's where it's mostly concentrated, up here in the northeast, and especially along the coast here and in the mountains just inland of there. Here it has a very, very complex series of hosts that it moves through. The important reservoir is that which the adult tick feeds on, and these are the deer. But deer don't actually suffer from the disease. They completely tolerate it. It just acts as a reservoir for ticks, other ticks feeding on them to acquire the spirochete. And it is here in the field mice that it actually proliferates the most. And the young ticks, immature ticks, I nearly call them baby ticks, but immature ticks, much more scientific, acquire the spirochete from field mice, and it is this stage here, moving between field mice and animals, or pets and humans, for example, that actually can give us the disease of borreliosis. So I'll just flash to the next slide and then go back. This is the typical result of a bite by an infected tick. Produces this bull's eye rash. Again, this reddening here is a result of inflammation in response to the presence of the spirochetes. And it's called a bullseye rash because you maintain this deep red right where the bite had. And then as the organism begins to spread out, it causes this circular inflammation around, looking like a bullseye. This causes a systemic, eventually it becomes systemic, and it causes a variety of symptoms. In many people, it's really mild and self-limiting, and some people wouldn't even go to a doctor or anything. It would pass off by itself. But in other people, it actually becomes much more severe, and many of the effects, again, are probably due to immune responses and it in particular can infect nerve cells and even infect the brain, causing an encephalitis, an inflammation of brain tissue. It can infect the facial nerves, causing facial paralysis and facial pain. All sorts of effects arise during a second phase. But there is a third phase, which some people unfortunately go into, which is a long-term chronic phase where the immune system begins to react against our own tissue, against the host tissue, as a result of the immune response to the spirochete. So it's like our immune system tries to battle the spirochete, and in doing so, it mistakes our own tissues for the spirochete. Even if you get rid of the spirochete, even if the spirochete dies out or is wiped out by the immune system, people can maintain this third phase. And this is typically an arthritis in the joints, an inflammation, painful inflammation of the joints as our immune system attacks our own tissues. These phases here, which are actually due to infection by the spirochete, these are treatable with antibiotics. But these long-term autoimmune responses are much more difficult to treat because they're not due to the infection itself. They're due to an error in the immune system. So there are numerous diseases which can be transmitted to us, to our blood vascular system, cardiovascular system, by arthropods. And ticks are one of the major ones. And there are others which are transmitted instead by biting insects. And one of the most important of these are the lice. A louse is actually an insect. It may look arachnid-like, it may look somewhat tick-like, but it is not. It's actually an insect. And lice are very common, extremely common in the human population, and they always have been. When they are divided into groups, the head lice is probably the one that's most familiar to you. Body lice, which are somewhat uncommon in developed nations, but more common in developing nations where people have poorer hygiene, and especially where they re-wear clothes without washing them over and over again. And then the third one is pubic lice, but which are not particularly important for transmission of disease. Now, lice can transmit a variety of diseases, but one of the most important are that they can transmit a strange bacterium called a rickettsia. And rickettsias are very, very small organisms. They have lost many of the features that would allow them to operate independently. And so they have become obligate intracellular parasites. And in fact, the ricketsias are one of the organisms that we look at as a possible origin for the viruses, because they've lost many of the cellular features that would allow them to be free living. Now, the ricketsias infect the endothelial cells. To repeat, the endothelial cells are those cells which line the inside of the blood vessels and of the cardiovascular system. And commonly, this was for all the rickettsial diseases. This causes blockage and rupture of these small blood vessels. At its least, a common feature for the rickettsial diseases is a rash, and that is because of this blockage of the fine capillaries all over the body. Now, the first disease that is particularly important is called typhus. And typhus is not to be confused with typhoid. Typhoid was that gastrointestinal disease caused by salmonella. Typhus is an entirely different disease, and it's can be a very serious disease, particularly under certain circumstances. It is transmitted by the body louse, and body lice proliferate in conditions of very poor hygiene and of crowding. And in particular, where people have no access to water, to any form of hygienic upkeep. So they are typical, these heavy infestations of the body louse are common in crowded, impoverished situations such as prisons, refugee camps, disaster situations, prison camps. All of these kinds of really dire situations are often accompanied by very heavy infections with body louse. And typhus can spread as an epidemic through these kind of situations. It's caused by Rickettsia prowazekii. And Rickettsia prowazekii is spread by the body louse, but in a somewhat strange way. It breeds inside the louse and is passed out in the feces. Lice cause itching, and so people scratch themselves, and this is where the poor hygiene comes in. In conditions of poor hygiene, people actually accumulate feces, louse feces on their skin, and when they scratch themselves, they scratch the rickettsia into their skin and set off an infection. Now, if a healthy, well-fed person was to acquire typhus somehow, it would probably be self-limiting. It causes a fever, high fever, and it causes this typical rash that rickettsias usually cause. But under poor conditions where people are malnourished, for example, and continually reinfected, it causes a prolonged chronic fever, which ultimately becomes so debilitating that people do die of the disease of typhus. And in ghastly situations like during the Holocaust, in the concentration camps in the 1930s, 1940s, typhus was a major source of mortality for prisoners. It still arises in disaster situations very commonly. There is another typhus. Typhus refers in general to these rickettsial diseases, but this one is one I'm sure you've heard of. It's Rocky Mountain spotted fever, and this is called tick-borne typhus. Now, here's a rickettsia which is being carried not by a louse, an insect, but by an arachnid, the tick. Again, this is another of the tick-borne diseases. The tick-borne typhuses, there's a huge array of them all over the world. And some of them, most of them, in fact, are self-limiting disease, very debilitating, but mostly self-limiting diseases. But this one, Rocky Mountain spotted fever, actually has amongst the highest mortalities of all of the rickettsial diseases. Untreated Rocky Mountain spotted fever accounts for about 20% mortality. Now, that's very, very high for an infectious disease. It's spread by ticks in similar way to as we saw before, but for the other tick-borne diseases, it moves through animal reservoirs. But it is very definitely treatable. But even treated, it causes a very debilitating illness. So this is the major distribution, again, towards the east of the country. In season, when ticks are breeding and widespread, it commonly occurs in hikers, hunters, people moving through countryside. Here's the typical rash. This is on the face, but it will be over the whole body. In children, this can be mistaken for measles, but these spotted fevers cause a rash on the palms of the hands and on the soles of the feet, which measles never does. So that is the one way that the differences can be spotted. And that's it for those diseases. I will conclude on Monday with a final random selection, basically, of other bacterial diseases which may be of interest to you. And I'll see you on Monday.